I'm Susan Roberti, and welcome to Let's Talk Tail Waggers. I have Dr. Volt today. What a wonderful, wonderful person he is. We're going to learn bunches of stuff. So please listen carefully because it's going to be very important. But before I get started, I want to say thank you to my camera person. Thank you, Dave. You know, BPTV is all volunteers, and you are more than welcome to come up and do a show. A cooking show, if you do your little girl's hair in braids and fix it certain ways, if you're a guy and you'd like to show people how to work on cars, there's a gazillion things. And if it's your passion, as pets are mine, it's so easy to do. Just come up and talk to Dave Cable and talk to him about it, and he'll let you know what you need. You really don't need anything but a good heart and a passion for what you like to do. So now I'm going to introduce Dr. Volt, and we're going to hear some interesting things. Hello, Dr. Volt.
Good morning. How are you?
How are you?
Good.
I'm so glad you came. I really am.
Good to be here.
Thank you. Thank you. So we decided that we're going to talk first about Lyme disease. I'm very, very worried.
Okay. Well, essentially, Lyme disease started in the Northeast, which probably most people know, and it is something that slowly worked its way into Pennsylvania, and more recently has been a very big problem because the weather is not cooperating. Oh. It used to be, we used to get cold enough winters that the weather would actually kill off a fair number of ticks during the winter, but we're getting much milder winters, and consequently there's many more ticks around to spread Lyme disease, and we're seeing a lot more in my clinic over the past 2 years. We used to, on average, maybe we'd see five cases a year that were having problems and had Lyme disease. Last year, in 2015, we saw about 30 cases, which was kind of a big change for us anyway. This year, we're approaching 60 cases, and we're not even at the end of the year yet. And these are not necessarily cases that are just turning the test positive. A majority of them are actually starting to have clinical problems with them. They're either having the lameness issues or something like that.
Okay, now what does this do to your pet or any animal that gets this?
Really for us as in people, the only real animals we have to worry about are our dogs, and if you have horses can get Lyme. Oh. Cats do not seem to have a problem with it. Pretty much just the dog world. Wow. It is kind of unusual, and people, a majority of people start by getting the big target lesion. It's actually a big red circular lesion on their skin. We are not going to see that on a dog just because there are hairs in the way, which, go figure. After that usually starts maybe 2 months after they're bitten by the tick. And then they start having the lameness problems. Usually it's just, it's they're limping or they're a little bit off. Maybe they have a little bit of a fever or they're just not right. And they're also with or without limping a little bit. The problem is not all patients go through that. Not all patients show the limping. For dogs, it's probably like 40 to 50% of them will actually have the limping going on while they're going through that phase of the infection. In people, it's probably about 50 or 60% will end up with the joint pain and the lameness that goes on with that. But that's a short-term kind of a thing that doesn't last very long, maybe a week or two or something like that. And then after that, the infection just lays around for a little bit longer. And then for us with our dogs, the issue becomes more, the biggest problem seems to be kidney related.
Oh.
It actually starts to affect their kidneys, and they end up drinking more, urinating more. What we try to do with them is if we suspect there's a problem with Lyme and they test positive for it, we actually will check their urine. The first thing they start to do in their urine is they start to lose protein out in their urine, which is much more than they should be, and that's a fairly simple test to do. And if they're having problems dropping a lot of protein, then they go on medication. And actually, unfortunately, that particular problem, they need to go on medication for 3 to 6 months.
Wow.
It's a long time.
Yeah.
But there are 2 or 3 medications that work very nicely for Lyme. Just 3 antibiotics. Doxycycline's the big one. There's another derivative of tetracycline called minocycline that also works. And then amoxicillin, believe it or not, works fairly well for Lyme disease.
Well, is this going to be for always? The Lyme disease, is it
Yes,
stay with them
we
always?
don't, our bodies don't ever really get rid of Lyme disease. The problem with Lyme is it's too smart, I guess, is a good way to look at it. It has the ability to hide. It actually, which is why you don't ever really clear Lyme disease. You put them on antibiotics and they're stuck with it forever. And the same is true for people. It hides in connective tissue. It hides in the glue between cells, and it's much more difficult for our immune system to get to it. And even if our immune system does find Lyme, there are problems where the Lyme itself, the actual organism, it's called a spirochete, it's not really a bacteria, it can actually change its surface so that your immune system will not recognize it as well.
Smart.
And just, too smart. I hate that. But it's just something that once you have Lyme, you're kind of really stuck with it forever. The interesting thing is, for dogs, they really feel that of all the dogs that are bitten by a tick that's carrying Lyme, 90% of those animals, 90% of the dogs are never going to have a problem with it. They're going to have Lyme in their body, but it's not going to cause any disease. 10% of the patients are going to get sick in one way or another. Typically, like I said, it starts with kidney problems, but there can be neurological problems and some other bizarre things that go on. But the 10% that actually get sick, you medicate them to try to get them down to the point where their body can deal with it again, and they're not sick from it anymore.
Yeah.
And again, you're never going to get rid of it.
Does that bother their joints? Dogs?
Long term, honestly, long term, the problem we tend to see is more kidney related. And the scary part is if your pet does not go through the initial, doesn't show you any outward signs at first, like they don't show you the joint problem, they're not limping or they're not sick or anything, and you don't even recognize it as being ill, which that's possible. It very well may be a very mild presentation that you don't think anything's wrong. And then it goes on and starts causing kidney problems. They can be pretty sick by the time that happens. And we had a dog come in last summer. It was only a 4-year-old Labrador that was already in kidney failure. And we lost that dog like 2 days later. And that people did not, the dog was never sick a day in its life. And then it came in
Well, I guess
deathly
that's
ill.
their immune system, huh?
Yeah,
That has to do with
immune
their...
system was doing basically either helping to hide it or just the disease, the Lyme didn't really cause a problem. And you just kind of, you just kind of
That's
have
heartbreaking.
That really is. That's a tough one, especially when you
Yeah. Now,
dog that young.
can people just ask you to check their dogs?
Normally what we do is if there's an outward reason, we'll check, like it's obvious that they've got a problem that might be Lyme, we'll test them. When we do our routine heartworm test, that test actually checks for Lyme disease also, and for 2 other tick-borne diseases that are not as prevalent around here, but there's one other one around that we see occasionally called anaplasma, which is another spread by ticks, causes problems kind of a thing. It actually kind of resembles Lyme in that it does cause some lameness issues and things like that. But
Now, what's this little critter look like?
really,
Is it the big one, the groundhog tick? Is
no,
it the
these
little?
actually the deer ticks are really tiny, and they're called a deer tick because they were originally found on a white-footed deer mouse in the Connecticut area or in the Northeast. It has nothing to do with the big deer that we see eating all of our shrubbery.
Yeah.
It has more to do with the little mice, because the younger form of those ticks tend to gravitate toward mice, because the problem is deer tick are really tiny.
Yeah,
Literally,
they are.
an adult deer tick is about the size of a freckle, so the likelihood of you finding them on your pet is pretty hard. It's pretty small that you're going to find them. The little younger ones, the nymphs, are so small they really gravitate toward mice because that's what they can catch. You know,
Yeah.
they just grab on and they're along for the ride, and then they feed and fall off, and then the next year they're an adult and they do the same thing again. They jump on an animal and feed and fall off.
Yeah, well, if you could take time, you're lucky if you find that tick.
Right.
You really, it's like, wow,
Right.
if you can. And a lot of times they'll be like on the back of the dog's leg because they get on the feet first.
Right.
And then they work their way up. And sometimes you'll catch them on the back of their ears
Yeah,
or air underneath their, where there's liquid. They like to be there. But they are so tiny that if you have a Saturday afternoon, folks, sit
you're bored.
sit down and watch TV and comb through your
That's
your
it.
dog.
The thing about ticks is when you find one, the best thing to do is just take a tweezers or forceps or whatever, and just put it just clamp right around the skin, right where the tick is attached, clamp them and pull them out.
Oh, you don't have to burn them?
You do not want to burn them. The problem with burning them is putting a chemical on them or anything like that. The problem is when ticks are feeding, they're just pulling blood in, and when they're done feeding, they actually regurgitate, which is when they pass the lime into their victim.
Oh, I did not know that.
So you just want to clamp them by the head and pull them out. Hopefully you got them before they were on that
Regurgitate, yeah.
detachment phase, because when you start burning them and things like that, they're going to go through that detachment phase. They're going to regurgitate and then try to drop off.
So everything that my grandparents taught me.
Yeah, right. Yeah. Things
It's
have
always
changed.
that way.
Things have changed in the past 20 or 30 years. But
Yeah.
so really right now it's just, if you find a tick on there, just clamp onto them and pull them off. And actually has been found that ticks will need to be attached for literally up to 48 hours before they will pass lime into the animal they're feeding on, or the person they're feeding on for that matter. So if you just grab it and pull it off, you're fine.
And put it in.
And just crush it, do whatever, just get rid of
Yeah.
it. After that, the more important thing, the most important thing for Lyme is tick control. It doesn't matter what product you use. It can be from a veterinarian. Literally there's about 30 or 40 veterinary-only products. Over the counter, there's got to be another 100, I would imagine, that will help take care of ticks and fleas. There are, a lot of them are topical. You just put them between the shoulder blades.
Yeah.
Some of them are spray. Some of them there's a couple of oral pills on the market now that work very nicely. There are collars. In the past, flea and tick collars pretty much used to be a waste of time. They really don't do anything.
Truly.
And currently, I still really feel flea collars don't really do anything. But there are a few tick collars that you can actually buy over the counter that work very nicely. And we use one in particular that we found 5 years ago that we originally heard of. All the firefighters out west were using these particular tick collars to wrap around their boots to keep the ticks from climbing up their legs.
Wow.
And so we started using them on dogs, and the nice thing is this particular one we use lasts 3 months. Now there's several other ones, and there's one on the market now that lasts 8 months, which is pretty impressive.
Yeah.
And it's anything that you have that you've ever used in the past, it doesn't matter what it is, as long as it's killing the ticks, you're in good shape.
Please use it.
Yeah.
And don't think that it can't happen to you, because believe me, it can. It can happen to you or to your pets.
Right,
And they
exactly.
really, some of them do get very sick from them, and so do human beings.
Right. Now the other thing that is unusual about ticks is that you need to use some kind of control year-round. Ticks are not affected that much by cold weather. If it's below freezing, the ticks are not moving. Actually, we were at a lecture a few years ago from a veterinarian who spends his life studying ticks, as exciting as that was. Anyway, if you go out in the middle of winter and there's snow on the ground, if you get to where there's leaves under the snow and lift them up, more than likely you're going to see ticks hiding under there.
Or fleas.
All they're doing is they're waiting for it to get warm enough. If it's over 32 degrees in the middle of winter, the ticks are feeding that day. They're not waiting for a month for it to warm up. They're feeding that day. I actually found that out myself 2 Christmases ago. So Christmas Day of 2014, I was in South Park on the mountain bike trails, walking, was with my family. We were walking the dogs. That night we had ticks on the dogs. It was 39 degrees out that day. It had been freezing that morning. It was freezing that night, and the ticks were out feeding that afternoon. So it's just something, just because it's cold out doesn't mean you don't have ticks around. And the way winters are going around here, we're getting 50-degree weather, and then it'll go down into the 15s for a while, and then it'll go back up to 40. And on those days, if it's warm enough, the ticks are out. So we're just saying put something on them, doesn't matter what it is, as long as it works, and do it year-round. And the other thing is, it doesn't matter what product you're using, but if you're using a product and you find a tick attached or you find fleas on them, that product is not working for your dog.
Okay.
Doesn't mean the product is bad, it just means there's something about that particular product with your pet that just doesn't work. We see that with pretty much any flea product. It doesn't matter what it is. None of them work on all dogs constantly. So it's just try something else. Just keep trying it until you find one that you don't find ticks on.
When I had my business and the ladies would come in and they'd say, oh, boy, it's so wonderful. The leaves are dying, the frost is here, you know, and they'd rake all their leaves up. And I said, well, what about around the bushes and the hedges and stuff down the backyard? I said, as long as there's leaves laying down somewhere, I said, there's critters under there. And I said, please don't think that you're not going to get a flea or a tick, because that's where they're at, hiding under there. And even, like you said, with the snow.
Yeah.
Yeah.
They're just waiting for warm weather.
Yeah, they're just waiting so they can jump on you. Right. What about a groundhog tick? Do you know anything about those?
Actually, there's several other ticks around, as opposed to just a deer tick. There's probably, and there's 2 big ones, the American dog tick and the brown dog tick, and they kind of feed on dogs plus anything else.
Yeah.
But there's several other kinds of ticks out there. Most of the tick products will work on most of those ticks. There are a few that there's certain ticks they won't kill, but pretty much all the ones that are out there will take care of deer ticks.
Well, it's good then to check them.
Yes, no matter what, look at them occasionally. Just honestly, the easiest thing to do is just kind of peel their hair backwards so you can get down to the skin and see it better, and you'll pick up fleas and ticks a lot easier that way.
Come up the back of the leg, because they like it where it's dark and shady. They like to come up there. And
go against the grain.
Yeah, up under their armpits. They really like that.
Flutter around the neck sometimes just because they can't get
to ears,
them.
because the ears drag on the ground, and they jump up on the ears. Yeah. But I really am so thankful that you're here to impress upon people that this disease is growing.
Right. It's becoming a much bigger problem, that's for sure.
And no one's talking about it.
Well, I think every veterinarian in the state is talking about it.
Yeah, but I mean, there's no programs.
It's not in the news.
Yeah, and there's no discovery programs or any of those kind of things that are telling people about these. Because I have people stop me and ask me about, how do I know my dog has Lyme disease? I said, well, I always say, well, you go and ask your vet.
Right.
If you find a tick on your dog, then go, well, how do I know what kind? Just go to your vet, and if you can, have that dead tick with you and show him, and he'll know, if it's a deer tick or not. But I did not know that it's from a little deer mouse. I thought it was.
Well, those ticks will get on anything. It doesn't matter. It's, deer, raccoons, possums, skunk. It doesn't matter.
Do they get Lyme disease?
Honestly, I don't know the answer to that question. I'm familiar with birds can be carriers of Lyme. Dogs get Lyme. Cats don't really get Lyme, and horses do get Lyme.
Aw.
Other than that, I think it's more. A lot of those animals carry the ticks around with them. Whether they actually get sick from Lyme, I don't believe that's a big issue.
Well, I know kitty cats can be full of fleas,
Right.
and
Yes.
they don't even scratch.
Yeah,
They
that's-
just seem like they have this natural immunity to these critters.
They're also a little bit better at grooming. They actually spend more time licking
yeah,
the ticks and fleas off of
yeah,
them, which
biting
is
them. Yeah. Well, I just am so glad that you came today to tell us about it. Now,
Good,
what
thank
about them getting spaded, getting fixed is important?
that is always a problem. Essentially, pet population is still a major problem. I used to work at a shelter. I was there 1 day a week doing surgery, did it for 15 years, and shelters are never empty. So there are way too many dogs and cats in the world, and spaying and neutering is a huge help. It's just, it used to be that even animals that came out of the shelters, 40% of them weren't getting spay and neutered.
Wow.
Because at the time, it used to be, adopt out your pet when it's a puppy, bring it back when it's 6 months old for surgery. Well, not everybody would bring their animals back. Well, now anesthesia is so
They have
safe
to.
that the shelters are all spaying and neutering the dogs and cats before they ever walk out the door. That has been a huge help in knocking the population back, but it's still, again, the shelters are still all full and are still fighting, huge population problems.
And you still have crazy people. Excuse me, I love you. I don't mean crazy people. But I mean people that believe that the dog needs the boy needs his
Right.
parts.
Keeping
and
his
it's not,
manhood.
and it's not true. It does not hurt them at all to
Doesn't-
do that.
Doesn't really change them. Honestly, with that particular issue, the only thing that I've heard is different is if you're taking a dog that is neutered and you put it next to a dog that is not neutered, if you're having a judge that judges dogs in a show ring, they might be able to see some nuances that are not the same. Little things they're looking for show dogs, and what the breed standard is. Personally, myself, I don't think I would be able to see those nuances. It's just something that it's just there. There's a little bit of a work going on now, and by that I mean research, that there's some concern that early age neutering might be affecting dogs later in life when it comes to their knees. There's many more. There are many more dogs that are having issues with tearing their ACLs, to the point where now the surgeons are even kind of wondering, like, why are we doing so many?
Yeah.
And the thought is that the early age neutering might have something to do with that. And the weird thing is, dogs that are neutered early age means when they're like 10 weeks old, 2, 3, 4 months old, that kind of thing. They actually grow longer. Their bones keep growing longer later in life than they normally would if they were neutered later. And consequently, it throws off the angle of their knee and puts more stress on their cruciate ligament, and consequently, they tear their ACLs more
That
commonly.
makes that, yeah.
But
I can believe that.
There's also now a group that's saying, well, we should not let those animals go through, neuter them later in life, like do it when they're a year old or year and a half old or 2 years. Well, the problem is for a female dog, there's a definite correlation between breast cancer and being spay.
Oh.
If they are spayed before they ever have a heat, they are never going to get breast cancer. That's just the way it is. And if they're spayed after one heat but before 2 heats, roughly those dogs are 80 or 90% less likely to get breast cancer. And after 2 heats, spaying them doesn't affect their incidence of breast cancer. As an old dog, like when they're 10 or 12 and they develop
Yeah.
breast tumors,
Yeah.
the incidence is the same whether they're spay at 6 years old or whether they're spay at
Okay.
3 years old. It's
Yeah.
going to happen.
Wow.
It's kind of frustrating. So essentially, the general trend, the feeling right now is to still spay them and neuter them when they're about 6 to 7 months old, somewhere in there.
Yeah.
The females tend to start going into heat when they're 9 months to a year old. We just want to get them hopefully done before they hit that
Before
9
they do,
months.
because then they don't get breast
They
cancer.
will not get breast cancer as
You
old
hear
dogs.
that? they don't get breast cancer.
That is
So
it.
it's really good for the girls, and the boys still know they're boys.
Right. They just don't mark territory as much is the help.
That's all. And it just protects them. But that is a good thing to know. Like 6 months, do you think you should get them done?
6-ish to
The
7-ish
boys?
months is when we're pretty much doing the boys and the girls right now.
Yeah,
Somewhere in there
yeah,
is fine.
yeah. Well, I guess that would be a terrible thing to say, but like growing plates for a young child, you know, and they're still growing. So if
Right,
you, yeah,
right.
yeah, and that is a hormone, I guess, that would still help.
It affects it.
Yeah.
It's-
Wow, you're super, God.
Well, thank you.
You are, and it's time to go.
All right. Well,
All
that was
right.
easy.
Thank you.
Thank you.
Oh, Dr. Volt, thanks so much for coming. You don't know, I was so worried about this Lyme disease. I've been reading and reading more about it, and I just even get goose pimples at the thoughts because nobody's paying any
Right.
attention to it.
Right.
So if you're out and about or talking, if you see this program, please spread the news about the Lyme disease. Check. Is it true if you cut your grass all the time and keep the grass short that it's most likely that you won't get ticks, or is that a wise tale?
Actually, the interesting thing about that is ticks tend to hang out in tall grass or on shrubs. And literally what they're doing is they're trying to get as high on the blade of grass as they can get, or on the leaves or whatever. And there's actually a video out showing a tick standing on the edge of a blade of grass with its legs up in the air, just waiting.
Oh my God.
Waiting for somebody to come by. So it's typically taller grass and bushes and shrubs and stuff where they hang
So
out.
if you keep your grass pretty short
That
in
will
the
help.
summer, that will help.
Not going to get rid of the problem,
Right,
but it will
it's going to
help.
help. Well, it's time to say goodbye, and my time always goes so fast with my wonderful, wonderful fans, and I do love you guys. The wonderful things that you say to me. I'm so glad that you have learned over the years some wonderful things about pets and understand them more, because that's what this is all about. I want you to remember the Pets for U.S. Vets. We're still doing that, and send your check to the Washington Area Humane Society and mark down at the bottom that it is for Pets for U.S. Vets, because you do know that if they go, anyone that's been in the service goes in and asks for a pet at Washington Area Humane Society.
That is a great program, by the way.
Thank you. We've gotten over 280 dogs
That's
so far,
great.
Holmes.
That's great.
And go in, and whatever service you were in, whatever time you were in, lady, man, and you can have your pet for free, and plus a year of wellness too. So, but we need money. It goes so fast because for the first 3 years it was kind of slow, and then now people are really catching on, which we're glad, but we do need money. So if you could please send us money. And all of your humane societies need your help. They need blankets, sheets, towels, anything that you're not going to give to the homeless, but common sense will tell you that it is good enough to send to one of your humane societies. They need those for operations and warmth in the winter. So please, if you have them, send them. That would be appreciated. And like always, thanks from all the tail waggers.